Like we see so often today, somebody doesn't really use a medical profession until it's an emergency,
Right.
and then they go to the hospital.
Right.
And unfortunately, when you're looking at the statistics on people of color, that's how pregnancy is treated.
Exactly. And most of the diseases, unfortunately, are treated as well. You know, their diabetes is diagnosed later, that impacts pregnancy. Hypertension is diagnosed later, that impacts their pregnancy.
Dr. Adegoke, what should the experience of perinatal care ideally look like in order to, try to get fewer and fewer disparities?
I think we've touched on some of those things in our conversation so far. Ideally, everyone is able to access good prenatal care. We know that access just on its own is not enough. Even people who have done all the right things and attended all their prenatal care visits, when you are a person of color, you still have higher risk for adverse outcomes. I think about what I would want if I were pregnant, if I were having a baby. Ideally, I would see the same provider throughout my pregnancy, somebody who knows my history and doesn't just know my medical history, but also knows my personal history, someone who knows me well, somebody who's working from the assumption that I am a person trying to make the best decisions for me and for my family. Best may look very different for me than it does for the provider. The calculus of what I use to decide what's best for me may be very different than what they would be deciding with based on our relative positions in society. But having that baseline respect sets us up to be able to have open conversations about what the medical recommendations are at every point, what the options are, and then how each of those options works best with or does not quite work with my goals, so that we are always having shared decision-making, open conversations around care. When I talk to my patients, they mention that they are afraid to go into a hospital to give birth. They're worried that hospitals are not safe places for them and for their babies. They're worried that healthcare providers and healthcare systems do not have their best interests at heart. And that is just a conversation that no one should have to have in 2021. It's absolutely unacceptable.